So this is about how to fix acid reflux, both on yourself and on your friend or your spouse. Acid reflux is a problem that affects approximately 100 million Americans. Many of the cases of acid reflux are really actually quite simple. Usually, acid reflux has two components to it. It'll have a hiatal hernia, and it may have a cardiac sphincter that's not functioning properly. Hiatal hernia means that the stomach has bulged up into the esophagus. The esophagus allows your food to come down into your stomach. There's a valve here called the cardiac sphincter. That valve opens, the food drops down into the stomach, the valve closes, and then your stomach digests it. Well, if the stomach is bulging up into that sphincter, then the sphincter can't close properly, and food and or acid can regurgitate up. Having acid going up into the esophagus is not a good thing because the esophagus was not made to handle acid. The stomach was. So when acid goes up there, it can create an ulcer, and if it's not corrected, then it can create esophageal cancer. So it's important that this condition not be allowed to exist. Now, the use of antacids and proton pump inhibitors like Prevacid and Nexium are designed to prevent the oversecretion of acid in your stomach, and so you don't have any acid going up into the esophagus. However, long-term use of these is detrimental because, number one, it decreases the amount of acid that you have in your stomach, which is necessary to digest your food. So if you're not digesting your food, you end up with what's called a leaky gut syndrome. In addition, they want to stop the production of acid so you don't burn a hole in your esophagus. Long-term use of these proton pump inhibitors also leads to greater mortality rates because one of the things that the acid in your stomach does is it digests and destroys bacteria and viruses. So we don't want this going on. So the way I deal with it in my office is we do a muscle test, figure out, is it the hiatal hernia that's bulging up, is it the cardiac sphincter that's not closing, or is it both? And we're going to teach you how to do both of them. Now, out of necessity, I had the condition, so I knew how to fix it on my patients, so I figured out how to fix it on myself. And that's the technique that I'm going to teach you first, and then we're going to teach you how to fix it on somebody else. So, at the juncture where the ribs meet the sternum, we're going to come a couple of inches underneath that, and we're going to just pull it down on expiration. So what it will look like is you'll breathe in, you'll take your hand with the fingertips pointing in and down, you'll take a big breath and you'll blow it out, you'll put your other hand on top and you'll push in and down as hard as you can. It's going to hurt a little bit, so it looks like this. Now, excuse me, it might knock the air out of your stomach a little bit as it did with me, but it will pull the stomach down, and you should notice a change in the symptoms of acid reflux. The second thing we're going to do is we're going to come in with our 5 fingers. Right at the point where the ribs meet the sternum, right here, you'll feel the bone, and there's a little hanging down piece called the xiphoid. You're going to come right under that with your hand, all 5 fingers touching those points, and clockwise you're going to push in and twist very fast, and we're going to shock the sphincter and get it functioning again. So we come in like this and blow it out. Just turn it really fast. It will shock that sphincter. Now if you want to increase the effect, you can make a noise. It's kind of style points. So actually the noise isn't necessary, but it may happen when you do that. Okay, so that's how to fix the sphincter yourself and how to fix the hiatal hernia yourself. Now I'm going to show you how to do it on somebody else, and this is the way I do it in my office. So I'm going to have Jean come on and stand right here, and we're going to do a muscle test on her facing this way. We're going to hold her arm out. When we do muscle testing, we want to find a strong muscle and then see what makes it go weak. So I'm going to ask her to hold. Hold real strong. Hold. That's it. Okay, so we know what strong feels like. If we swipe down the front of her body like this, we're going to mess up the acupuncture meridian that's running up the front of her body, and her arm should go weak. So hold real strong. And it does. And then we fix it by going back up this way, hold. Good. So you can learn how to do that pretty easily. Just practice a little bit. Hold constant pressure for about a half a second after you tell them, hold. This is not a wrestling match. We're not trying to break the muscle. We just want to put pressure on it, firm, steady pressure, and you'll feel it either goes weak or it doesn't. So hold, and I give her a chance so she knows I'm getting ready to do the test. I don't want to just say hold and press before she has a chance to respond. I wait about a half a second and then I press. So once more, and hold, good, and hold, great. So now we're going to come right at the confluence of the ribs, and we're going to check to see if she has a cardiac sphincter that's not working. Hold. And she doesn't. That's doing fine. Now we're going to come a few inches, right about in between the belly button and the xiphoid, or the bottom of the ribs, right about in the middle there, and we're just going to push up. And if she has a hiatal hernia, where the stomach is bulging up, the muscle's going to go weak. If she doesn't, it won't. So hold this real strong. And hold. And she does. Now she's had problems with this previously that we fixed a few months ago, and it looks like it's come back again, so we're just going to do it again. So I want you to lie down on your back. Now, what we're going to do is we're going to have her bend her knees, so bend the knees up, and we're going to come right here, right about 3-4 inches above the belly button, and we're just going to put our hands in there and we're going to pull it down. So we're going to lift this up. So we're going to come, here's her belly button, we're going to come right here and take a big breath and blow and straighten out your legs. So that will pull the stomach down. To reinforce this, we're going to come along the rib heads, and we're just going to massage them gently all the way down to where they end at the ribs, and you'll feel the ribs. And then we come up. Come on up and stand right here. And we're going to test, and if we fixed it, the muscle should be strong. If we didn't fix it, we'll have to do it again. Hold this real strong. And that's good. Good, so that's fixed. That's how simple it is. And you'll know because the next time you eat your meal, you won't be tasting your stomach juices, you won't be having a lot of belching and a lot of gas. So symptoms of hiatal hernia: belching, gas, tasting your stomach juices, various forms of indigestion, chest pain. All those are symptoms of hiatal hernia. So I hope that helps you. Thank you.